Agriculture and a medical officer within the Ministry of Health. I'll just acknowledge the members of our head table. Honorable Dr. Francis Anthony, Minister of Health. Honorable Dr. Ashmi K. Singh, Senior Officer within the Office of the President, responsible for Finance and Public Service. Ms. Priya Basu, Executive Lead for the Pandemic Fund. And Ms. Tanya Dmytrychenko, Practice Manager for Health, Nutrition, Population for Latin American Caribbean countries in the World Bank Group. I'd also like to acknowledge members from the Pandemic Fund and the World Bank Group, our UN Diplomatic Corps, our partners, our governmental and non-governmental agencies, and of course, acknowledge our Chief Medical Officer, Dr. Narayan Singh, and our Permanent Secretary, Mr. Malcolm Watkins, in the Ministry of Health. The government of Guyana, through the Ministry of Health, partnered collaboratively with the Pandemic Fund and the World Bank Group to implement the Guyana One Health project, which is basically aimed to strengthen Guyana's capacities in preparing, preventing, and responding effectively to health emergencies. It is our understanding that beyond the structure, healthcare structure, which focuses on doctors, pharmaceuticals, there are other systems in place that play a vital role in public health and emergencies, including disease outbreaks, or pandemic response preparedness, and supporting non-communicable diseases. So thereby integrating animal health, human health, and environmental health. So let us get the ball rolling, and I'll invite our first speaker, Dr. Anand Prasad, who will give an overview of what the project entails, the Guyana One Health project.
Good morning, everyone. Thank you very much, Dr. Wiltshire. I want to adopt the protocol so ably observed by Dr. Wiltshire and acknowledge the members of the head table. And I'll also reiterate the welcome by Dr. Wiltshire in welcoming all the partners and the agencies that are present, especially our UN agencies, our visiting members of the World Bank and the Pandemic Fund, our honorable ministers for gracing us with their presence and participating in this activity. And even though they're not here, I take the opportunity to acknowledge the Honorable Minister of Agriculture and the Honorable Minister of Local Government and Regional Development, who have also played an important role in development and will play an important role in the execution of this project. Ladies and gentlemen, I know that I can give you 30 minutes. I'm told by the MC that I can take 45 if necessary. So if you need me to leave the stage, just let me know. But my task here today is very simple. It's to give you an overview of what the project is and how we're planning to execute that. Most of you in the room are very much aware of the details of the project, what it entails in general, and of course some of the more detailed implementation plans. But just for the sake of clarity, we'll just do a quick run through. So Guyana's Pandemic Prevention, Preparedness and Response Project has been dubbed the Guyana One Health Project. And fitting, because it is one of the two projects that is currently being implemented by the World Bank, that is a One Health project. And for those who are not necessarily clear on the concept of One Health, it might be a little bit strange still, even though it has existed for many years. It is the encompassing of public health by looking at animal health, human health, and environmental health together. So, maybe just going back a little bit before we go into the actual project, I just wanted to clarify the backdrop or the context upon which the project was developed and has been selected, thankfully, and is now being able in a position for implementation. Going back a little bit, maybe 2020, when we had the COVID-19 pandemic, or the beginning of the COVID-19 pandemic, I think many in the room, and even those beyond, across many countries, they realized there were critical systems that really required attention. Systems that are not typically public health related. You think about healthcare, you think about hospitals, nurses, doctors, and you think about pharmaceuticals and beds and so on. But behind the scene operationalizing a public health system, there are certain systems that need to be in place, especially to prevent, prepare for, and respond to pandemics. And so we realized during the COVID-19 pandemic
systems that, for want of a better word, were neglected in some way or another, not only in Guyana, but across the world, because priorities were placed differently. So we speak about, for example, surveillance systems, we speak about laboratory systems, we speak about training and pandemic response. You never think it's going to come until it does arrive, right? So the pandemic fund was developed with an interest to address these deficiencies and gaps that were identified during the COVID-19 pandemic and other public health emergencies of international concern. And so we identified 3 key areas for us to make proposals and then implement plans if they were chosen. Those are early warning and disease surveillance systems, laboratory systems, and of course workforce and human resource capacity building. And of course our project focused on all 3 of these very important areas. Thankfully, on the second row, because the first half of proposals we weren't selected, but we were very close. And in the second round we were selected and we were given this project, given the grant for this project. And the implementing entity for the project is the World Bank Group. The value of the project is $15 million USD through the pandemic fund, and then thankfully through the leadership of the government also, they've added a $7 million USD line of credit through the IOH line. We have the Ministry of Health, the leading agency. Although we're leading, it's a collaborative effort, and the project, of course, is single country. Essentially, the project will be executed by the Ministry of Health in collaboration with our partners, and the World Bank will be providing that expertise and guidance as it relates to the monitoring and the execution of the financial aspects. What is the project development objective? So I'm just going to read it exactly as it is for you in the project. So it's to strengthen Guyana's capacities to prevent, prepare, and respond to health emergencies through a One Health approach, and in the case of an eligible crisis or emergency, respond promptly to it. So it encompasses those 3 areas that we spoke about earlier, and it's exactly as it says: prevent, prepare, respond to health emergencies. Interestingly, a new component of projects by the World Bank is where you're able to reallocate funds in the event of an emergency. That is a new component that has been included and accounts for the last sentence. The project in its essence aligns with the government's intention to take a different approach towards healthcare. And that is a typical siloed approach. We now want to take a One Health approach, coordination, collaboration, and it goes beyond implementing activities and projects. It's speaking about the strategic level, and I'll go into that a little bit later on when we speak about the committees that have been formed to support not only this project, but the broader One Health initiatives across the country. The overarching objective is to elevate the country's capacities under the IHR to expedite progress in key public health pillars. So maybe just to mention, this project, when it was being developed, it wasn't a project that was done municipally. When we heard about the grant and we decided, well, let's apply for the grant and see if we'll be able to get some funds to it. No. Thankfully, during the COVID-19 period, another project was implemented, and that project was done, the COVID-19 project, in collaboration with the World Bank. And through that project, we were able to conduct a number of important assessments. The pathway to veterinary services at the Ministry of Agriculture. We were able to complete SPAR assessments over the years, and do that in a multi-sectoral participatory way. And then we also conducted for the first time in Guyana the joint external evaluation, voluntary external evaluation, where we had colleagues and experts coming, so ably afforded by WHO, who assessed different capacities related to surveillance and workforce and laboratory, and said we recommend A, B, C, and we use that expertise, we use that knowledge to develop this project, and also develop for the first time our National Action Plan for Health Security, which involved the participation of a number of agencies and sectors. So the project in itself is a reflection of all that work that has been done previously, and thankfully when the pandemic fund came about, it aligned perfectly with what we were trying to do from the inception. The specific objectives of the project, I'll just go through a few of them. So it's one, a unified, efficient public health laboratory network. So that's important, expansion of the laboratory network, integration, digitization. A rapid data-driven health surveillance system, similarly the same. Expansion, creation of surveillance systems in the region, integration through software, looking at better ways to do data analysis for policy and implementation of activities. Strengthening public health workforce is another key area. It's not just a question of increasing quantity of healthcare personnel, but the quality also. Training that is consistent,
and training that involves modules embedded into the established training mechanisms that already exist in the Ministry of Health and is being expanded across different professions. Enhanced border security, another big area which is very important. We learned during the COVID-19 pandemic that we're not able to close our borders whenever there's an outbreak or disease. But now we're able to ensure that we have control mechanisms at our points of entry to monitor conveyances and cargo and travelers, which is very important. Equitable access to healthcare. Throughout the project, we're going to ensure that we have modules incorporated in our training activities and all the other different projects we'll conduct, which includes gender ethnicity and inclusivity. And then we have strengthened multi-sectoral capacity for health. So this goes beyond the meeting at a workshop or meeting at a meeting and then having a collaboration. Now us, the technical person, are able to formalize the way we work, data sharing, coming together and reviewing and assessing situations, and then of course devising ways in which we can mitigate. The project in itself is divided into 5 components. The first 3 of them are of the most substance and importance. The first is to improve laboratory capacity, strengthen public health surveillance, and then strengthen cross-sector collaboration, which is the key in essence of the project and encompasses a number of activities. Just to give you a general overview of what the project will be covering, for example, we have the first one here, vehicles. And you might think, oh, this is a typical project where you just buy vehicles and you bring it in, but that is not the case. The vehicles that will be procured for this project is to implement for the first time in Guyana a national sample referral and transport system with the corresponding drivers and vehicles suitable to the terrain and the regions where they'll be deployed. And that will support the entire laboratory network and ensure we have early diagnosis and response. Operationalization of new surveillance units in the regions require resources to do their work, and so you'll see those items are placed there. Software is another big important area and aligns the government's intention to ensure that we're now digitizing and synchronizing the work that we're doing. So importantly, we're going to be developing software that is interlinked and not just separated the Ministry of Health, Ministry of Agriculture, the points of entry, an integrated piece of software that has modules that will be able to bring that data together. Connectivity is another important area. Infrastructure, I think one of the biggest parts of that is where we're going to be doing upgrading our National Public Health Reference Laboratory, so a BSL Level 3 laboratory, which is going to be one of the first within this Caribbean region. Accreditation and guidelines are always important. We want to ensure that when we update our services and update the quality of the work that we do, that it is accredited, and not by our own local standards, but also by the standards internationally accepted. So we're improving the quality of work. Training is a big aspect. It deals with continuous training and modules like I mentioned before. And then of course we have some module hiring and consultancies to expand the workforce, train the workforce, and in terms of consultancies, not just a short stint, but be able to work along with our colleagues, train them, teach them the things that they might need to learn to now adapt to these new systems, but let it be continuous. So just to maybe coming to the end now, in terms of project management, the project will be managed by the Health Sector Development Unit in the Ministry of Health with the guidance of our colleagues from the World Bank and their technical team. But beyond that, like I mentioned before, the idea is not just to have a project we coordinate now and then at the end of the project it's closed. The guidance of the Honorable Minister of Health and the other ministers also present, a decision was made to create 2 committees that was advised also by partners at the World Bank. That we should create 2 committees. One is a National Steering Committee, which will be high level, and it will be led by the minister is present and a lot of your colleagues. And then we have a One Health Technical Committee, which will be led by our AMR focal point, Dr. Shaw. And these committees will work together towards implementing the project, advising the project implementation units, but beyond that, advise on all issues related to One Health in Guyana. So bringing together issues relevant to human health, animal health, and environmental health. The agencies I've placed here are all the agencies that have participated with us from the beginning, from the SPARS, from the IHR meetings, from the Joint External Evaluation, and we wanted to recognize their work. Even though they might not be direct beneficiaries in some of the activities, they will benefit from the collaboration, the participation, and the strengthening of our systems. So that brings me to the other presentation. I hope I didn't take up the 45 minutes I was allotted. And I just wanted to conclude by saying, here in Guyana, the Ministry of Health, especially amongst our technical colleagues, we are very glad for this. We're very excited about the project. We're very excited to go towards implementation. And we are very thankful to have the support of our Honourable Minister and the Honourable Minister Ashley Singh and the other ministers who I mentioned earlier, because it takes leadership to implement such a project. And I can say without a doubt that we have that leadership, we have that guidance, and it is pushing us towards that direction. So I thank you very much, and I do hope you enjoy the remainder of the ceremony.
Thank you, Dr. Prasad. Just want to reiterate the fact he went through what our project entailed, and basically 5 components, but it encompasses 3 key areas: early warning systems and disease surveillance, our laboratory systems, and human resources as key to building our Guyana's capacity. So now I'll invite Ms. Tanya Dimitrichenko, who will be looking at positioning Guyana as a regional leader in One Health.
Good morning, distinguished guests, colleagues, and partners. It's really an honor for me to join you today at the launch of the Guyana One Health project. It's a historic moment that marks not just significant investments in the Guyana's health security, but it's also a transformative step for the Latin American and Caribbean region. This is a very important agenda and one that many partners are supporting, as we can see from the participation of the diplomatic corps here today. Today celebrates for us not just the launch of this groundbreaking $22 million project, but it really represents the convergence of a vision, of partnership, and unwavering commitment to protecting the health of people, animals, and ecosystems. The project, as you know, is financed by a $7 million credit from the World Bank, specifically the Ida Development Association, as well as the $15 million from the Pandemic Fund. So this really stands as a testament to the achievement that the government has made in really showcasing Guyana in a very competitive field with many different governments competing for these resources. I really wanted to acknowledge the Ministry of Health's leadership, and again, not just in Guyana, but I think setting an example for the region and worldwide. The pandemic, this project, the World Bank project, the One Health project, is the first World Bank supported project in the Latin America region, and only 2 worldwide, the other one being China. Company of some pretty big players. And I also wanted to acknowledge, I think, Guyana's courage in not only submitting the pandemic fund proposal, but then also going through the rigors of the World Bank process, which I acknowledge brings a lot more work for you. But also, I wanted to acknowledge that Guyana succeeded in preparing a World Bank project in 4.5 months, which is well below the 12-month average that we are aiming for. So congratulations. And thank you, because it helps us look good within the bank. So thank you very much for that. Again, I wanted to acknowledge that this has the entire team, because there's been a very large team working to get to this point with many different partner organizations. I wanted to acknowledge my own team and your team. team as well under the leadership of Dr. Anand, but I know that it's been very many people, and I don't want to mention them by name because I fear that I will leave some out, but I will acknowledge the different organizations. This project really didn't start here either. It really draws on the lessons from the COVID pandemic and from the World Bank project supporting the government of Guyana as they've weathered the COVID pandemic, and it exposed critical gaps in surveillance and coordination mechanisms in laboratory structures, not just in Guyana, but across the globe. And the pandemic has really taught us that health security cannot be left as a second thought. Right? They can bring down the whole world economy if we're not thinking ahead and really breaking through the fragmented approaches and the siloed thinking that I think preceded the pandemic and left us so exposed. And really combating future health endemics really requires an integrated approach that can detect, respond, and prevent these health threats before they become a global crisis. The One Health Project in Guyana has been built on a strong technical foundation, one that is rooted on comprehensive assessments. And I'll say here the courage to have those assessments, because I think countries often felt vulnerable and didn't want to expose their weaknesses. But Guyana was courageous and included, and some of the assessments included the joint external evaluation, the veterinary epidemiology evaluation, the performance of veterinary services assessments, and these were really fundamental and rigorous groundwork to ensure that the project aligns with the Guyana's National Action Plan for Health Security and its broader vision for Health 2030. The project's really designed to strengthen national capacities, but it's not only that, it's really positioning the country to do sort of groundbreaking work and is serving as a model for regional cooperation in One Health, and in particular, emphasis on health emergency preparedness and response. I think, for example, that the lab is going to really serve as a reference for the Caribbean region, a reference laboratory for the Caribbean region, shows as an example of why this is not just a Guyana project, that this really has positive spillover effects for other countries in the region, and also offers a lot of opportunities for cross-border learnings, including Brazil, with Colombia, and other countries. This technical soundness or an ambitious scope of the Guyana Health Project would not have been possible without the strong partnerships that underpin this project. And here I specifically wanted to sort of acknowledge our technical partners, including the Pan American Health Organization. You'll see I'm just and the Food and Agriculture Organization, and the Inter-American Institute for Cooperation on Agriculture, the Caribbean Public Health Agency, and as well as some of the contributors such as the Mount Sinai Health System, working in collaboration with the Hess Corporation. And this is really advancing Guyana's health transformation through innovative digital technologies, as well as cancer care and other spillover effects beyond pandemic preparedness. This is really also this partnership exemplifies how private and academic actors can complement and strengthen the public health leadership of the public sector in this area. For me, this is a really project that is innovative and has a really not only that it brings many different actors partners within the government. We also want to acknowledge the Ministry of Agriculture, but it's also one that brings in private sector partners, academic institutions, and many different international partners that have made this a technically very strong project, and one that will benefit not only Guyana, but other countries in the region. And we really look forward to this partnership and seeing this through. This is just the beginning of a very long love affair, I hope. Marriage. Marriage.
Thank you, Ms. Musichenko. It's amazing how much, I know a lot of hard work was been put into making this project a success. And to do it in such a short time, it just shows how committed we are to advancing and strengthening Guyana's capacities. So now I invite Ms. Priya Basu, and she'll be looking at leveraging collective investments for one more.
Thank you so much. Good morning, honorable ministers, esteemed members of the diplomatic corps, colleagues and partners. I'm honored to join you today at this official launch of the Guyana One Health Project. Really a milestone in the efforts to build and bolster the country's capacity to prevent, prepare for, and respond to public health emergencies. So let me begin by congratulating the government of Guyana and the World Bank team, and all the partners and agencies that have worked tirelessly to bring this project to life in record time, as Tanya mentioned. I'd like to extend a special thanks to Minister Frank Anthony, who represents the Americas on the Pandemic Fund's governing board, for his leadership, support, and unwavering commitment, which have been instrumental in guiding the strategic directions of the Pandemic Fund in the past 2.5 years. In November 2022, on the heels of the COVID pandemic, the international community came together at record speed, so this journey has always been at record speed, to establish the Pandemic Fund. As the first of its kind multilateral financing mechanism dedicated exclusively to investing in pandemic prevention, preparedness and response in low and middle income countries. The fund's establishment was one of the most significant global achievements that emerged from the lessons of COVID-19. The Pandemic Fund has moved forward quickly to allocate $885 million in grants that have mobilized an additional $6 billion from international and domestic sources, so a leverage ratio of 1:7, for 47 projects across 75 countries. And a third round of funding with an envelope of $500 million is currently underway, with proposals expected on the 6th of June actually, and the expectation to allocate the resources by the end of this calendar year. So the Pandemic Fund's model is designed to be catalytic, helping governments secure and invest additional resources to become better prepared for emerging outbreaks. The projects we support are country-driven and they are country-led. We seek to provide financing on budget. We focus on multi-sectoral, One Health approaches that aim to break silos. And we take a disease-agnostic approach by supporting countries to build capacity that will help with early detection of multiple pathogens and prevent outbreaks from spiraling into pandemics. These key defining features of the Pandemic Fund are reflected clearly in the project we are celebrating today, as we heard from Dr. Persaud in his presentation. The Pandemic Fund's $15.6 million grant to Guyana is catalyzing an additional $7.6 million in co-financing from the World Bank's International Development Association, as well as almost $89 million from domestic co-investments. So this really speaks volumes about Guyana's commitment and the World Bank's strong support. And here I want to acknowledge the World Bank team, as well as the Pandemic Fund Secretariat team. Nicola, my colleague, is here in the audience. We are a small team. And of course, Frederica and us from the World Bank. We're a small but mighty Further, I'm pleased to see that the project is taking an integrated approach to investments in the important areas of surveillance, laboratories, and health workforce strengthening. And these are really the backbone of effective pandemic prevention, preparedness, and response. Integration and digitization of human and animal disease surveillance systems, modernizing and connecting public health and veterinary labs, which we visited yesterday, and equipping a new generation of health workforce are vital to managing the risks of zoonotic outbreaks. And these represent smart, forward-looking investments in resilience and long-term prosperity. And the project is not just about systems, it's actually about people as well. It will support the next generation of the health workforce, from laboratory scientists to quarter officers and frontline workers, equipping them with the tools, training, and networks that they need. It's also about cross-border collaboration and partnerships across all levels. The government of Guyana is bringing together the ministries of health, finance, agriculture, legal affairs, natural resources, and tourism for a whole-of-government response. And this effort is supported by the World Bank as the project's implementing entity, as Tanya mentioned, drawing on the deep technical expertise and convening power and multi-sectoral knowledge of the World Bank with support from organizations like PAHO and UNICEF and so on, FAO as well. The project engages a wide range of partners from civil society and local communities to multilateral and regional institutions. This kind of multi-partner, multi-sectoral collaboration is absolutely vital to building health systems that are resilient, inclusive, and responsive to future outbreaks. So Guyana's commitment to strengthening capacities for pandemic preparedness really does demonstrate courage and forward-thinking. We must not forget that the last pandemic cost millions of lives around the world, trillions of dollars lost in economic growth, and set back years of progress in health, in poverty reduction, and growth in the most vulnerable countries. The next pandemic could be just around the corner. It's a question of when, not if. Investments needed to get to the right level of preparedness to prevent that pandemic are a fraction of the costs of not being prepared. So congratulations once again to all those who have made this project possible. Together, we are making an investment in health, in economic security, and in long-term prosperity. The Pandemic Fund is here to support you, to support Guyana in building stronger, more resilient health systems for the future. We are proud to be part of this journey, and we look forward to continued collaboration to achieve results. Thank you.
Pandemic Fund World Bank Group is a small and mighty bunch, but really they do significant work. A lot of things are behind the scenes and we don't know, but to see that we have a project that focuses on One Health, looking at, as she said, human resources and health, it's been making a significant impact to preventing, prepare health emergencies, because as you said, it's not if, it is when something comes along, we need to be prepared. And so thank you once again, everyone involved. I'd like to now invite Honorable Minister Dr. Ashley Singh to the
Thank you very much, Madam Chair. Permit me to acknowledge, of course, the presence of my cabinet colleagues, the distinguished Minister of Health, members of the diplomatic corps, in particular the Ambassador of the United States of America to Guyana, the Deputy High Commissioner of the United Kingdom to Guyana, and others who I might miss, representatives of various international organizations, in particular, of course, the Pandemic Fund, represented in the current instance by its head, no less, the World Bank, UN agencies, staff of the Ministry of Health, ladies and gentlemen. As I came into the room, the first thought that hit me was that this is a little bit of a tight squeeze. And I disrupted the whole room as I wriggled into my designated seating corner, which proved, of course, to be very comfortable. I did send a message to somebody that the air conditioning vent was aimed at me and I was shivering a little bit. And they very graciously, the letter very graciously said, arranged for the air conditioning vent to be turned down. But there I was, happily sitting under this cold air. And many of you alongside wonder why I engage in this preamble. But we live in the age of instantaneity. We live in an age where there are expectations of immediacy, and short-termism is widespread, rampant, and our memories are short. We only remember that which took place a few minutes ago, and we consider a distant memory that which took place 5 years ago, much less 10 or 15 years ago. The tightness of the huddle this morning, in fact, we're all sharing the same cold, or perhaps not so cold, depending on how many scarves how well equipped you came, came well equipped. But us breathing the same air and huddling in this tight squeeze, a mere 5 years ago, a mere 4 years ago, would have been in many jurisdictions prohibited by law, whether temporary or otherwise. Generally there were temporary laws or regulations, public health regulations. 5 years ago, even perhaps I believe up to 4 or 4.5 years ago, this would have been unthinkable. And even if it was not prohibited by law, we would not do it. This room would be empty. This room, there would have been rubber tiles or sticky posters on the ground telling us where we should plant our 2 feet, just in case we were not able to mentally measure what 6 feet should look like. We, all of us in this room, there's nobody in this room who's less than 5 years old. We all lived through that. And sometimes we forget it and we take it for granted, Now it's a distant memory. We don't even remember it. We come, we embrace each other, we sit next to each other, we breathe each other's space. We don't think twice. We don't think of it. But just a few years ago, this was impossible and prohibited. And if anything, if COVID taught us anything, it is that we needed as a world to be better prepared for threats. Public health threats, but indeed threats of a broader nature. We in general needed to build our resilience. Certainly on the public health front, but also on the economic front. We forget sometimes what economies looked like under COVID. We came into office, this government started our current term of office in August 2020 in an environment where there was a complete lockdown. Face-to-face interaction were not permitted, even where they were permitted on an exceptional basis, they were generally not done. Almost the entire non-oil economy. In fact, there were special arrangements in place, even in relation to the deployment of the one oil platform in production at the time. But certainly the whole of the non-oil economy was at a complete standstill. And because recorded a significant contraction in 2020 because literally every sector had shut down. And that was the context in which we came into government. And we had, in the first instance, and as our foremost priority, we had, of course, the imperative of keeping the people of Guyana safe, developing a capability to, first of all, contain the risk of spread of COVID-19, develop the capability to treat those who unfortunately would have contracted the COVID-19. We had to breathe oxygen back into the economy, and so that meant a careful, phased, but urgent, nevertheless, reopening of the economy. We had to implement several measures to ensure that we bring our economy back to a growth path. Today we take for granted that we're sitting in a hotel, like I said, but hotels were empty, hotel staff were sent home. But this one, of course, didn't even exist. It would have been unthinkable to build a new hotel. Airlines were closing down because nobody was traveling. Hotels were closing down, hotel staff were being sent home. The economies of the world were in free fall. And if we are sensible as a people, as a global people, we have an obligation at least to have learned the key lessons from that period to ensure that we are better prepared going forward. And in Guyana, I would like to think that we have demonstrated that we certainly learned that lesson. We are building every day a more resilient economy. We're building, of course, in the health sector, a sector that is dramatically, astronomically better prepared now than it was 5 years ago to deal with pandemics and the risk of pandemics, health emergency, and the risk of health emergencies, etc. And I took careful note, I mentioned to Priya that I took careful note of a reference to the phrase health, economic security, and long-term prosperity. Because that literally brings together, I thought in a very nice way, the various strands of what we're doing here today, and indeed what we're doing more broadly nationally. I want to share with you just a few very brief thoughts, because of course Frank is going to speak more expansively on what we're doing in the health sector. First of all, I want to make the following point, that Guyana is in the news today. We enjoy a level of visibility around the world that we've never enjoyed before. And a lot of that is because of the rate at which our economy is growing, and indeed the manner in which we're managing the economy to ensure long-term competitiveness, long-term and sustainable growth, and to demonstrate that we are an example of managing a resource endowment in a sustainable manner for the long term and in the interest of long-term prosperity for our people. And that's why that phrase particularly resonated with me. So a lot is known about Guyana, particularly because of the economic story, the headline of rapid economic growth, fastest growing economy in the world, etc. Less is perhaps known about what we are doing as a country and as a government during this period of economic growth in individual sectors that are, each of which is critical to ensure that the pieces come together to form an effective, single, comprehensive picture, and a picture that reflects this long-term resilience and prosperity. Like I said, Frank will come back and speak about health and perhaps many other things. I don't want to confine Frank. Frank is a very experienced member of the cabinet, of course, he will speak on everything. But if I were to reflect only on the manner in which we have ramped up our investment in the social sector. In health alone, in 2019, Guyana spent $35.8 billion in the health sector. In 2025, we've budgeted $143.2 billion. That's a 300% increase. And by any measure, a 300% increase in the health budget over 5 years, by any measure, is astronomical. But even beyond the budgetary allocations, the fiscal allocations for the health sector, is what we are realizing, the build-out of healthcare infrastructure. And I don't want to give you that speech today, but that speech alone is going to take the rest of the morning. But the build-out of healthcare infrastructure, not only on the coast, not only specialist hospitals, but even in the hinterland, and addressing issues of equity in the health sector, including, for example, the deployment of technology like telemedicine to ensure that even in the most remote communities, people are able to access good quality diagnosis and good quality treatment in a timely manner. The deployment, like I said, of technology, the training of human capital development, the training of people. We're training more doctors and nurses and nursing assistants than at any other time in our country's history. We have said anybody, our president has said, any Guyanese person who meets the entry requirements to become a nurse and applies to be trained as a nurse will be given free training as a nurse and will be given a job as a nurse. So the rollout of an unprecedented, ramping up and rolling out of an unprecedented wave of training and human capital development, which of course not only is about the healthcare system, but it's also about creating economic and employment opportunities for individuals and for families and improving their lives, bringing more young people into work, bringing more women into work, and giving them good quality jobs and opportunities to improve their education and opportunities for professional upliftment and economic empowerment for their own well-being and their own prosperity. And there's a huge story going on there that, really needs to be told. We try to tell it, and sometimes time permits, time often doesn't permit, but there's a huge story going on there. The second point I want to make is that this event really represents an incredible example of partnership. Because of course, we have been doing this with ramping up our own budgetary allocations in the national budget. But we have been doing this and we have been doing this with, and we could not have done this without the support of a number of very important development partners. At the risk of perhaps omitting some, I'll mention, of course, we have the traditional development partners like the multilateral institutions. The World Bank has been an outstanding partner to Guyana across the entire development spectrum, but particularly in human capital development, in health and education. And Diletta, I want to thank you very much for the work that you have done yourself and your local team, your team at the local office. But also the various sector specialists and sectoral teams that have been working on Guyana. I want to ask you to convey also to Lilia Baruchuk our sincere thanks. She continues to be a fantastic friend to Guyana and to the Caribbean. And of course, Vice President Carlos Felipe Jaramillo, who has also been a remarkable friend to Guyana, has contributed tremendously to the remarkable work, excellent work that the bank is doing. So we've had the support of traditional partners like the World Bank. I see the IDB in the room. The IDB is also providing strong support to us. But I want to also acknowledge well, first of all, the pandemic fund, recognizing it as an independent an entity in its own right. And we're delighted. I remember receiving originally the letter inviting us to serve on the board of the pandemic fund. Of course, Ms. Anthony has represented the entire hemisphere on the board with distinction. And we're very proud of the leadership that he's providing. But the pandemic fund itself is an example of partnership, bringing together several individual bilateral contributors to the fund. And I want to acknowledge the fact that the United States of America is the largest contributor to the pandemic fund. And in fact has contributed 30% of all of the resources pledged to the pandemic fund. So Ambassador, thank you very much. And all of the other bilaterals with the UK, the European Union, and all of the other bilateral partners. I was particularly happy. The project itself is designed to reflect, I mean, if I were to go back to the COVID-19 metaphor or analogy, if COVID taught us one thing, apart from the need for preparedness, it also reminded us of the interconnectedness of the world. Our own interconnectedness. Somebody else's problem can't be dismissed as somebody else's problem. Inevitably, there are all sorts of stories in the butterflies in one part of the world, causing storms in the other part, the opposite side of the world, and so on. But COVID-19 also taught us the interconnectedness of the world. And I remember hearing about this distant thing that was happening on the other side of the world. And the next thing I knew, airports were being closed on my side of the world. And supermarket shelves were empty on my side of the world. And so the involvement of other partners, the fact that the project is designed to reflect the intersectoral involvement in this, the agricultural sector, for example, and animal health implications for pandemic preparedness and so on. And so I was happy also to hear the role of the UN agencies acknowledged, and they continue to do excellent work. I see Gillian here. It would be remiss of me. I never miss an opportunity to acknowledge the fantastic work that the FAO is doing, and Gillian in particular, with PAHO and CARFA and others. And so the project represents also a good example of partnership in my mind across sectors in Guyana and across development partners, multilateral, bilateral, or others. I want, thirdly, and perhaps finally, I want to say that we often speak about leveraging resources, and I always say that every dollar of our bank money should be used to leverage some more. And I'm particularly pleased that this project also illustrates that, exemplifies it, because what we have here is, it's interesting how we present things, because Priya, of course, said the $15 million of pandemic fund resources have been used to leverage $7 million of IDA resources. I've heard the letter presented the opposite way around. I've heard the letter say, you see how powerful $7 million worth of IDA resources can be. So, but we have here now $7 million worth of IDA resources being matched with $15 million of World Bank resources. And of course, 15 let me say that again from the beginning. What we have here is a matching of $15 million worth of resources from the pandemic fund being matched. I'm not going to get into who is leveraging who. Being matched with $7 million worth of IDA resources. And we're delighted that we are one of the early countries to become eligible for a pandemic fund grant. And I want to thank you for that, Priya and your entire board. But I want also to highlight the role of IDA here, because Guyana has been a long-standing beneficiary of IDA, and we've been a long-standing supporter and champion of IDA. And I've never missed an opportunity to say how important IDA has been in addressing the needs of the most vulnerable, the poorest countries and the most vulnerable of situations. And when Guyana was in a very different economic situation, we were an IDA, when our economy was much smaller and much weaker, we were an IDA beneficiary, and we demonstrated our capacity to absorb IDA resources and to successfully deploy IDA resources to address the needs of the most vulnerable people in our society. And so we've continued to be eligible for IDA resources, and I hope that that lasts for a very long time, notwithstanding our changing economic fortunes. You know that I will fight for every dollar of IDA resources as long as I possibly can, and I couldn't miss the opportunity to make that happen. But I want also to acknowledge the role that has been played in several capitals in supporting IDA. And in particular, I want to acknowledge publicly the United States of America for your continued support to IDA, recognizing that, and of course, the U.S. Treasury Secretary has also spoken about the importance of IDA and the multilateral institutions in discharging their core mandate. And IDA is an important aspect of that architecture. So, Ambassador, I want to ask you to note our strong appreciation of IDA and of the U.S.'s contribution to IDA, the U.S.'s continued support for IDA. And the same message, of course, to other capitals. Of course, the UK, the Deputy High Commissioner for the United Kingdom, is there. I wouldn't miss an opportunity to slip in a word for the United Kingdom's continued support to IDA. It's for your historic support, but also in anticipation of your continued support for IDA going forward. But let me stop there because, of course, Frank is still to come. Frank is still to come. But thank you very much for inviting, for the opportunity. Frank, thank you very much for inviting me to be here and for joining you. This really is, it's an incredibly important project. It will have historic impact. But for me, in addition to that, it conveys all of these other, it reflects and symbolizes all of these other important things. And I really, I would conclude by saying that it might, in the grand scheme of things, appear to be a relatively modestly sized project. But building better preparedness and resilience, if we learned anything at all from COVID-19, and I think we did learn from COVID-19, building a more resilient public health system more broadly is not only an essential, but an indispensable part of building a more resilient economy and a more resilient country going forward. And so for that reason, this project is an extremely important one, and I'm delighted to join you in launching it this morning. Thank you very much.
We have come a long way from the pandemic, from social distancing, closed borders. We've really come a long way, and know that we're trying to build our capacity to make a more resilient Guyana. We're moving in the right direction. So now I'd like to invite Honorable Minister Dr. Frank C.S. Anthony, Minister of Health.
Practice manager at the World Bank, and of course the World Bank team, Dr. Priya Basu of the Pandemic Fund, Ambassador Giro, Deputy High Commissioner, other members of the Diplomatic Corps, and I see too many staff here of the ministry. Permanent Secretary, Mr. Watkins, Chief Medical Officer, and a lot of people who worked during the COVID pandemic and did amazing work. First of all, I want to say that we're extremely pleased that we had this opportunity of partnering with the pandemic fund and the World Bank to be able to come to this point where we can launch this project. I think the first time when we tried and we weren't successful, there were lots of disappointments, and but we said nevertheless, the second time around we'll try again and see what happens. And the second time around we were successful, and I think the team was quite happy. In fact, I think they were elated. They put in a lot of work, and that work was not just, I guess, of what we needed to do. They actually went through this in a very scientific way. And during Dr. Annan's presentation, we were seeing that methodology. Because we thought it was important that we situate the proposal into things that we really needed. And if we're going to understand what we really need, we can't just be guessing. So that was why we did that assessment, state party assessment, using lots of stakeholders. We brought in people from different ministries, different organizations, and they helped us to craft that assessment. But not being satisfied with it, if we were going to do a good One Health project, we also needed to understand what was going on with the animal population, because we all know that the likelihood of another pandemic is probably going to be from zoonotic disease jumping into the human population. And we need to understand what is happening with our animal population here. And there are many things that we just didn't understand. So domestic animals is one thing. But what is going on with the wildlife? What is happening in that population? It's kind of challenging for us. And so we brought in Panatosa, who was able to help us to do the assessment, the veterinary assessment, so that we can understand where the gaps are in animal health. And we took that into consideration as we were formulating this new project. We also were not satisfied with all that we had done in terms of these assessments, and felt that we needed independent verification in a sense. And so that's why we brought in the joint external evaluators to see what really are we getting this right. And so they did a report, and we were able to see where the gaps are. How did that match with what we already did? And so, putting all of this together, we then felt that we would have a very strong technical proposal to take to the pandemic board. And that's how this evolved. But it also evolved from our experiences with COVID. Because I remember, our first case of COVID, at least the one that we knew of, was on the 11th of March, 2020. And that person was accidentally discovered. So the person came from the United States, got sick, came into the Junction Public Hospital, and died at the hospital. And they couldn't quite figure out what was happening with this person. And then somebody decided to check for COVID. And the person tested positive for COVID. By which time about 52 persons, staff members, had come in contact with this patient. And that's the first patient that we discovered. And it was quite accidental. We, of course, I wasn't the Minister of Health then, because we were still in a challenging situation. The election had just happened, and before there was, all this problems with the counting and so forth. Eventually, in early August, when the president was sworn in, and then I got appointed. So we had our first cabinet meeting at the Papa Chung Convention Center. And at that first meeting, while I was making my way over to the cabinet, where the cabinet meeting was going to happen, the President said to me, he said, you don't know. You go across the road and see what was happening at the COVID hospital, because this is a big hospital that was being built to deal with COVID-19 patients. So I went across the road, and when I got there, I was quite surprised, because this hospital was launched twice in the newspapers. We have this thing ready, and actually I think it was renamed 3 times. It was a different story. And so I got there, and walking through this place, and I discovered this hospital had no electricity connected to it. It had no water. The sewage was not connected. In fact, the building was unfinished, and there wasn't a single bed for a patient. They had no ventilators for anybody. They had not a tablet in there to treat anybody. So basically, the first word that I think came into my head, I said, this is a shell. And I think the newspapers ran with that. They said, the minister said it's a shell. But that's what it was like, because we really had a facility that was supposed to be built for COVID patients that we weren't able to put a single patient in there. And so we have this on one hand, and at the time the government had spent quite a lot of money for that facility, but it was incomplete, and not a single patient could have benefited from that. And then in the main hospital, the Georgetown Public Hospital, they had an ICU section of the hospital with 7 ICU beds. And they were putting critical COVID patients on those beds, which meant that anybody who had a heart attack or any other problem that needed ICU care could not go to the Georgetown Public Hospital because there wasn't a critical care bed for them. So on one hand, the hospital was trying their best to deal with COVID-19 patients, critical patients. And that was the only ventilators that we had in the system. So with critically ill patients, we couldn't manage them, at this new facility that was being built. And we didn't have adequate things in the hospital itself, the main hospital. To compound that problem, we were not doing enough PCR testing. So our PCR capability at that point in time, we actually repurposed a piece of equipment that we bought for HIV 20 years ago. And we repurposed that to do PCR testing. And so the amount of tests that we could do was quite limited. And at the time, I think we were probably doing like 35, 10 tests max per day. We didn't know what was going on in any of the regions. And it was a frightening situation. So even if you had a patient that you suspect clinically had COVID, and you take off a sample and you send it down to the main lab, the National Public Health Reference Lab, at a minimum, it was taking us at least 9 days before we could get that result. By which time, that patient would have either been healed and gone about their business, or they might have gotten critically ill, and then we have to figure out what to do there. We had no ventilator capacity in any one of the regional hospitals. None. We had no isolation room. Our testing was very poor because we just didn't have test kits. We didn't have PPEs, believe it or not. We didn't have PPEs. N95 mask was almost non-existent. And that was the situation that we inherited. So we understood what it meant to be in a crisis. And that's why when we came into government, the president said we have to put the resources to make sure that we can deliver proper health care for the population. And he did not spare a single cent in delivering those resources to us. And that was why in a very short time, we were able to ramp up a number of things that we were doing. And among those things that we were able to do in a very, very short time was we went to the World Bank and we got a loan of $25 million US, right? 25? 22.5, right? And with that, that helped us to do so many things. And so when we decided to, who would be our partners on this pandemic fund grant, we had no hesitation. We said the World Bank is going to be our partners because they were there with us when we needed them, and they provided the resources. And what was very, very important for us, they were quite flexible. They were quite flexible in helping us to get what we needed. So when we needed to get laboratory equipment, they didn't say, well, you can't do this or you can't do that. They were quite flexible in helping us to get the equipment on time. And because of that flexibility, we were able to bring in some of the most modern PCR equipment, automated. And so rather than waiting 9 days to get a PCR result, we were doing it within 3 hours. And we had batches of 96, I think, on the, I saw a few on the subway just now. Right? It's 96, well, you call it? And we were turning them out very quickly. And we looked at how we can improve our software so that we can get the results to people very quickly and so forth. So it was a total revolution of what we did in a very, very short period of time. So we started improving testing very quickly. Apart from testing, we brought in a lot of PPEs so that we can have the masks and everything else available to people. And as we were doing that, in those early days in August, we didn't know how many patients we had, how many hospitalizations, how many deaths were occurring. We didn't know. So we started a thing every morning, and I see some people in the room smiling because they know what I'm talking about. Every morning at 7 o'clock, we had maybe about 20 to 30 persons on a call, a Zoom call, and we'll go through every region to tell us how many persons they tested, how many people were positive, how many were in hospital, how many were critically ill. We have to do a medevac, and we do this every single day at 7 o'clock in the morning. And if we have to go until 10, we go until 10. And we did that for 2 years almost. So there are many people in the room here who remember those days because they were very diligent, they worked very hard. Now again, we had some harsh words, but part of what we needed to do. But we got the job done. And I think that was what we did. When we started doing vaccination, that was another thing. We used the same mechanism to see how, what coverage we were having. And some of the staff were out in the vaccination to prepare the vaccine before the morning. And we enlisted the help of the Army. And they were the ones collecting and helping us with logistics so that we could move things to some of the most remote villages. And they even helped us to do some of the work, so to speak, to make sure that we were recording who's getting vaccines and all of it. So it was an amazing coming together of different entities working for one common objective. and that is to secure the health of the Guyanese people. And while we played a part and we were able to direct some of this, it was all the agencies that helped that made us achieve the results that we were able to accomplish. We had vaccination rate for first dose at close to 89%, which was really high across the Caribbean. And second dose, we didn't do too badly either. And I think during that period when we administer the vaccines, our population is not that large, but we did administer 1,329,500 doses. So I think that was important. And in one year after we started doing testing, 1 year we did 642,000 tests in one single year, moving it from almost zero to taking it up to that level. So the experience of COVID, it actually taught us a lot of lessons. And even with the vaccination, it was one story trying to get vaccines. And you remember those challenges that the vaccines were not distributed evenly to different countries. That was very challenging. But when we were looking for or trying to get the Pfizer vaccines, it required us to have freezers that was -70. We had none in the country, 0. And if we were going to administer these vaccines and we don't have these freezers, where are we going to store them? So one of our allies, we reached out to the United States, and they didn't give us one freezer. We got 5 from them. And we were able to start that ultra-cold storage where we were able to store our vaccines when we eventually got them. We also did -20. And so now we have capabilities of doing the range from -70, -20, right down to room temperature. And while we were doing that, we also wanted to strengthen our cold chain. So we developed regional vaccine hubs across the country. And then we developed special containers to be able to take out the vaccines across the country. And right now, learning from this experience as well, we started at almost every one of our health facilities now. We have a vaccine refrigerator in some cases where they don't have solar power, where they don't have electricity. We're powering those refrigerators with solar. So we still have a few to complete, but we are almost there in terms of having these refrigerators across the country so that we can strengthen that cold chain. That's a lesson from COVID. Dr. Singh spoke about the expansion that we're doing in healthcare, the new hospitals that we're building. We're going to complete 6 new hospitals over the next 3 months or so. We will open all 6 of them. These are 75-bed hospitals, accident emergency, pharmacy, imaging suite, which includes not just X-ray, but CT scan. We have 3 operating theaters, outpatient, full works. And the hospitals, we can accommodate 75 beds or 75 patients. But we have designed the hospital differently. So the rooms, each one of the rooms, while they contain 5 beds, it's not a centralized system. Coming back to the point of the air, it's not a centralized system. So every 5 beds or every room, it will have its own type of ventilation. So if we need to isolate people, it's much easier to isolate persons here. And then I remember during COVID, when we started up the hospital, and by the way, within a month from August, when we didn't have anything and none of this was connected also at the Lilydale facility, Our first patient, we were able to get our first patient in the first week of September 2020. So within a month, we were able to activate this. But we had challenges. And among the challenges, if we wanted to give somebody oxygen, we had to literally roll in a cylinder and put it next to their bed to give them the oxygen, because we didn't have centralized oxygen in the system. And there was one case where a lady who was in there, she was not seeing well, and she was wearing glasses and misplaced her glass. And actually, the bottle of oxygen fell on her and injured her. So we had cases like, so we were trying to move away from the cylinder to have a centralized system, which eventually we did. But that also taught us another lesson, because we spent millions and millions of dollars buying oxygen alone for patients, millions and millions of dollars. And the lesson that taught us was that at each of our hospitals, we must have our own oxygen plants. So all 6 of these hospitals that we are opening, we are making oxygen on site for the hospital. And that's a lesson out of COVID. And of course, we were able during that period to get a donation from the United States too, of oxygen plants, which we have one right now at Lethem. We have another one in Region 1 that is working and making oxygen for us. But the idea now is that all of our hospitals will have oxygen plants so that we can generate oxygen. So there are many, many lessons that we've learned from this experience. And we pull all of this experience that we've had and put it into this proposal, because we don't want a repeat of what we had to go through. It was really a harsh experience for us. And while the general population might not have known of many of the challenges that we have to go through, I think the medical team, the people in government, the leadership understood how challenging those things could be. Because even when you had money and you wanted to buy things, it wasn't available on the international market. And even if it was available, the time for it to get it was quite challenging. So we learned from that experience. Now in moving forward and in preparing for future pandemics, as I said, we feel that we need to have better surveillance on the animal population, because zoonotic diseases can easily jump from that population into the human population. We have seen examples of this, for example, with bird flu, where from birds it infected cattle. Cattle, the people who handle the cattle can get infected, or sometimes if you have contaminated milk, you can get infected. So there are examples like this that is very real. And we have to be mindful, because if we are not able to monitor these types of viruses, then we can have challenges. Similarly, we have to build our capacity at our laboratories, because with pathogens now, it's not waiting until somebody show clinical signs. We have to be able to do molecular or genetic surveillance of these types of pathogens. And to be able to build the capacity to do gene sequencing. And as COVID has shown us, it started out with one thing, but then every couple of weeks you're seeing mutations, you're seeing variants, you're seeing different strains. Some of them can escape the current treatment that we have. So if we have vaccines for a particular strain, but it's ineffective, we need to know that. And if the treatment that we're using is ineffective, then we need to know that. The only way we can know that is to be able to do the molecular surveillance. And that's the kind of capacity that we want to build at the National Public Health Reference Lab. Now, in the Caribbean, CARFL was doing some of that, but even CARFL would have limited capacity. So by adding more capacity and tracking more pathogens, we will be able to offer, not just for ourselves, but offer this for the rest of the Caribbean. And we, over time, we see ourselves becoming a good reference lab for the Caribbean, because as we build this capacity, it is going to be an asset not just for Guyana, but for the rest of the region. And that's where we're headed. And the training that we'll be having similarly would help us to move up that level. So with this particular funding, we're strategically putting the money so that we can develop better systems. The surveillance systems that we're looking at, to have it in all the regions, this is going to be a big improvement. All that I described when we were doing those 7 o'clock in the morning meetings, all of that was done manually. Think about having a system that can do this all electronically, and you can see it on a live dashboard. So that's what we want to move towards. And we have examined a number of options of how we can do this. So with the resources, we'll be ready to roll this out and make that a reality. We must be able to see what is happening in any part of the country. And once we see a hot spot, we will have rapid response teams that can respond in a very timely manner so that it doesn't become a problem. So that's what we're aiming to do with these resources. And as I said to you last night, Ray, that we would be able to deliver good results in a very short time. Because as you heard, the team not only break the record for the World Bank, right? For 12 months, they did it in 4.5 months. And I believe that the results that we are looking for, because we see it as very important to our system. So we're not doing this because we have to meet some requirement of the bank or whatever. We are doing it because we want to do it because it's important for our health system. That's why we're doing it. So you will see us start delivering on these results. The surveillance system, the multi-sectorial nature of the surveillance system, I think that is very important. The training that we'll be doing, the uplifting of our laboratory systems, going in different directions where we will be able to look at pathogens, look at things that we can't do right now. Over the last year, we have been doing some improvements, but certainly with these resources, we will improve even more. And I think it's just this particular funding is coming at the appropriate time when we are doing a lot of expansion, but we have set aside this niche with this particular funding. So it will help us to realize some of the things that we wanted to do for pandemic preparedness. And I think from the experience that we have had and what we will be doing during this project, we can be an example to many of the other countries in and around Guyana, because the way that we have approached it is very systematic. And the results that we're hoping to get, we feel it is based very scientifically grounded. And that would be, it would take us from where we are now to the next level, and then we go to the other level. So that's what we're doing, step by step. So as we launch this One Health project, this is going to be very beneficial to all of us here in Guyana. And with the resources, with the investments that we're making, at least in my generation, we shouldn't have to go through what we went through during COVID. And we'll be better prepared for anything that comes our way, and so that we can protect our population from the onset. So once again, allow me to extend our gratitude to the World Bank, team, Enrique Denaz, the team, the local team, Sonia, Dr. Anna, and this team, for the work that they've done in terms of getting this proposal, making it technically sound, and then to the Pandemic Fund for giving us the resources to making this possible. And to all our partners who work with us. We have done very good work with PAHO, They have always been there working with us. And outside of what we've been doing here with the pandemic, we have another agenda with PAHO that we've been looking at eliminating certain diseases from Guyana, which includes filaria, leishmaniasis, Chagas, leprosy, and so forth. So, and that agenda is on track for 2030, when we'll be able to eliminate these diseases that have been in this country for centuries. And we're on the verge of eliminating them from Guyana. We have also been working with them on treating people with hepatitis C. We have one of the only program in the Caribbean where we are treating patients who have been diagnosed with Hep C. And we are hoping that as we expand that program, we will be able to eliminate Hep C from the country as well. And we are, with the other infectious diseases, whether it's HIV, TB, malaria, we have been showing very promising results. So that by 2030, we're very confident that these will no longer be diseases of a public health concern in Guyana. So there are lots of exciting things happening, and this will add to the excitement because we now have the resources to do much more. So thank you very much.
Thank you, Honorable Minister. We have come a long way over 5 years, increasing our laboratory testing, improving our health infrastructure, but we still need to go further, a step further, and that's where this project comes into play. It will help us improve our surveillance systems throughout the country, having interconnectivity among the regions, improve our molecular genetic testing, as Minister said. It will do so much to strain our human resources in all capacities, all areas, lab, surveillance. So this is just, we're launching now, but we still have more to do. We still have to go so much further, and I know we can do it. So we want to build a resilient Guyana, and we're moving in the right direction. So prevent, prepare, and respond effectively to health emergencies. So thank you all for coming here today. Everyone in attendance, all our invitees, our special invitees, our ministers, our persons from the World Bank, Pandemic Fund, ministers, everyone, all our stakeholders, thank you for joining us in launching something that will be so valuable to Guyana. I wish you all the best, and I hope I know we'll continue to have progress in the future. Thank you. I must mention, you all can come forward to have a group photo with the person. From the diplomatic corps, ministers, others from World Bank, your agencies.
Can you tell us if we can all move? Sure, she can.
Yes.